Hello, everybody. Today, we wanted to have a discussion about an important topic that a lot of parents come to early intervention inquiring um, when their child isn't talking as well as they see other children do at their age. So this is a very common concern for parents. And so today, what I'd like to do is kind of discuss what language delay is and how it compares to other um, disorders that can be very difficult to differentiate sometimes, like autism spectrum disorder. My name is Subarna Dharia. I am a pediatrician with Infant and Toddler Connection, and I support this early intervention group here in Fairfax County and have been doing so for close to 12 years. So, today, what we will discuss is the differences that we might see between children who have typical language and then those who have a language delay, like an expressive language delay, and then other children who might have social communication delays or disorders, like autism spectrum disorder. I'm going to go through kind of the criteria for autism spectrum disorder so that's more clear and easily understood. We will talk about what we know about what causes autism, and maybe even talk a little bit about what sorts of ideas other people might have so that you can know the fact from the fiction. It's important to understand how autism and language disorders are diagnosed, who provides the diagnosis, and then what kind of evidence-based treatment options are available, and how to access those things. So let's start with a video that kind of describes what language looks like in the young child. And this is really, we're going to focus on even 0 to 2, 2.5 here. And you'll see that in this public service video, the developmental pediatrician focuses on 3 areas that are most important when looking at language development for any child. And those 3 things to listen for are the child's social engagement, their attention to language and how they attend, and then how they try to communicate, so their effort or intent to communicate. So all 3 of those things are actually very important to develop language.
Skills are developing. We're going to look at social engagement, attention to language, and communicative effort. So starting with that 7 to 8 month old, a baby of that age is a highly social creature. Some of the signs of social engagement are a baby lighting up, really engaging when spoken to, making strong eye contact, sharing a smile and a vocalization. Referencing back refers to looking back at somebody to help make sense of a situation, a baby playing with a toy and looking to see somebody else's reaction to what they have before them. And then there's imitating.
I just want to point out this referencing back is really quite crucial. It's another word to describe it is called joint attention. And so that joint attention is is one of the foundational skills that we see that starts to develop at this age, 7 to 8 to 9 months. And that's something that we often see is missing in some of the children who possibly have autism spectrum disorder.
Beginning to do what they see others around them doing. In terms of attention to language, baby's been paying close attention to everything that the adults in the world have been doing.
Anna, look!
And what are those adults doing? They're doing a lot of talking. Yes. One of the first things baby is paying attention to and making sense of is often their name. Julian. When a baby this age hears their name, they should look up. In addition, if the baby has been introduced to and expected to follow commands with a gesture, come to mommy, give it to daddy. This is an age where they are able to follow those early first commands with a gesture. In terms of their own ability, their ability to communicate what it is that they want and need. Even before that first word appears, a baby this age is highly communicative. The signs of communicative intent are making strong eye contact, vocalizing, giving a general gesture in the direction of what the child wants. Now we're going to look at 12 to 15-month-olds. What do we expect in terms of social engagement? A book. They engage in more reciprocal exchanges.
Want more?
Longer so-called conversations back and forth. They initiate more. The all-important point emerges. That's a way to direct somebody's attention elsewhere. They also are in a position to understand another's point. They can follow their mother's point to another activity as well. In terms of attention to language, in this age group, we're seeing babies able to understand a lot more language and follow commands without that gesture to prompt them.
Good job.
Now, when you say bye-bye, baby will just pick up their hand and start waving bye-bye, carrying out the gestures to songs they know.
People on the bus go up and down.
Pointing to body parts.
Where's the baby's nose? Beep. Yeah.
In terms of the baby's own ability to communicate, it's a very, very clear communication when a child points at something that they want. And now, parents have been waiting a long time for this.
Daddy's on the phone. Yeah.
Often, those first words also appear. Now we're going to look at 18-month-olds. In terms of their...
Before we get to 18 months, I just want to point out that when we are talking about pointing, as you just saw in that earlier clip, the child is not actually touching the object. They are pointing in the direction of it. So, those are just two differentiating things to consider when we're looking at pointing. It's not necessarily like holding the object or putting the finger absolutely there to the object. But yes, as you can see, there's a lot going on in these very young infants and toddlers here that show how much that they are learning language. Let's keep going.
Engagement. These are kids who now are not only engaged and imitated and initiating, they're pointing and directing people's attention elsewhere, and they're using that a lot to show.
See my blouse?
Showing is a really social skill. When you demonstrate to somebody, oh, look over there at that train that's going by, or the dog, and look back at a parent, you're initiating a real social exchange. In the area of
And just to point out again that what she just described with pointing over there and looking back at the parent and, showing them what they're interested in, that is a more clear joint attention that we like to see happen in these young children.
attention to language, the toddler can follow many and more complex commands. The toddler has the attention span at this point to engage with a picture book and go back and forth reciprocally with the adult, pointing out the things that are labeled or things of interest. In terms of their ability to communicate, we have words to indicate wants.
You need bubbles.
Those same words will now also start to emerge in terms of pretend play.
Ouch.
They'll try to narrate, maybe start to make the sounds of the baby sucking or the car moving. We're getting vocalization coordinated with pretend play. The 24-month-old is a social sophisticate. She is a ham. She wants your attention and she knows how to get it.
Where's the city?
At the park.
At the park.
This child's social engagement is demonstrated in that forum. She's wanting to show you everything, engage you constantly, all the time. In terms of attention to language, they understand everything around them.
Yeah, I think that way. That looks like the top.
They understand complex directives.
Uh-oh. Should we wipe it out? Do you need a cloth to wipe it?
They understand other people's conversations.
There we go. Is that all better now?
And And then in terms of their own communicative ability, they should have a vocabulary that's 200 words and growing. Demonstrate many two-word combinations or longer.
He has nails.
He has nails?
In addition, they're using that language for a wider range of purposes. Now, it's not only to make requests, it's to direct the activities of others. It's to comment. It's to say they don't want to do something.
Do you want to feed them now? Me?
And they're bringing that language to their play as well. Play, pretend play really takes off.
What do you think they like? Pasta?
How far our toddler has come in 2 years.
So as you can see, this is, there's a lot going on with these typical toddlers and even infants as they start to learn language. And I'd like you to keep in mind those 3 areas because we'll come back to them as we continue on. Let's move on to what, an expressive language disorder might look like. So many parents come to us worried about their child not being able to talk. As you can probably imagine from watching that video, there's usually so much going on behind the scenes for a child who may just have an delay in their expressive language because they still have that language comprehension typically. So that means their ability to understand language is still within normal limits. And the other aspect of it is that they still have that intent to communicate, right? So they're using other ways. They may not be able to verbally express themselves, but they're using every other way they can, using gestures and other things like pointing and facial expressions. Maybe their turn taking or tone of voice, other things that they can do, to make sure that their intent to socialize and engage and communicate is being recognized. And they do understand some social behaviors and social cues, at a very young age, even if they're not able to actually speak words. They have some of those other prerequisites: the social engagement, the attention to language. Some specific things that you might be able to see in these children at different ages, as you can see, have to do with, maybe not smiling or not babbling as they're getting into infancy, or starting to not using gestures as they should, not understanding what other people are saying around them, and of course, not speaking words. So this is from the ASHA page, which is the Speech and Language and Hearing Association, which has a lot of good information about language and language delays. So when we look at a child who has a language delay and try to differentiate that from autism spectrum disorder, or ASD, some of the things that we might see with a child who has autism include, having some challenges with eye contact in a variety of locations with different people, and following your point. So a parent or a caregiver, especially after 12 months, also not necessarily responding to their name at this point. Then whether or not they're starting to show objects or point to things, like we had just talked about a little bit in that first video, you can see that, those are really social ways of communicating, and you don't need any words in order to do those things. But if those things aren't happening by the time they're 15 months, it's just another concern that we want to investigate for autism spectrum disorder as well. Pretend play is a really important skill that children learn at this time just from watching their parents or their caregivers, the people around them. So that's something that we want to see occur. And imitation, as well as how they copy different actions or movements or sounds. And we expect that to happen, at least before 16 to 18 months. So let's take a quick look at a video of two twins who are about 19 months old, and you might see a difference in their behaviors. One has autism and one is typically developing.
Push. 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 Uh-oh. Yeah, it fell off. That's right. Here it is. Uh-oh. Go. Push. Good boy. Ready, set, go. You can push. No, stay up here. Stay up here. Go. Stop. No. Nathan. Go. Look, here it is. Here's the train. Stay up here, please. Push. Good boy. Ready, set, push. Go. Push.
I think it's pretty clear to see the difference in their facial expressions, how happy and engaged that Benjamin is, and that Nathan is really more focused on the toy than the social interaction between mom and him. He's turning the toy upside down and maybe focused on the wheels turning, rather than that turn-taking sort of game that mom is trying to do. I don't see him look at his mom the way that Benjamin does. When the toy fell down, he was very much looking at his mom to say, "Hey, what happened?" So even without the language piece, obviously Benjamin is saying push and Nathan is not. There's other things that he that Nathan might not be doing, like attending to his mom's words or engaging with her at this point. Let's just look at one more video that might clarify any other behaviors that we might see with autism, and then we're going to go into some of those criteria right after this.
Children with autism have significant impairments in social interaction and communication. It is this, in combination with the presence of repetitive behaviors or unusual interests, that should signal concern to a trained observer. Think about how typically developing children naturally show a strong interest in interacting, communicating, and sharing their ideas with others, and easily shift their attention between people and objects.
You want me to blow bubble? Yeah. Can I have the cup? Where's the cup?
Typically developing children listen eagerly to speech and try to figure out what you mean from gestures and other social cues, even before they understand the meaning of words.
Bottle, thank you. Can I have this?
Children with autism have a core deficit in social attention. This core deficit impacts learning and has a cascading effect on brain development.
Get them open.
Do you notice how this little guy is just so focused on this bubbles, very happy about the bubbles container, but does not even once glance around him to see his mom or the other person in the room.
You want more bubbles?
Autism interferes with a child's ability to listen to speech, to notice gestures, to look at faces, and to pay attention to what is important in the learning environment. Autism impacts the ability to learn from people.
Where's the bottle? We're going to say bye-bye to some of these things. Bye-bye, cup.
These developmental consequences are cumulative and can lead to pervasive deficits and extremely challenging behaviors.
I think you can also see that he's playing with the toys a little bit differently than you might expect another child to do pretend play with. He's maybe more interested in the sound that the bowl makes as it rolls around, or the rotation of the bowl on the table. So those sorts of things are more interesting to him, rather than kind of pretending to eat from it.
If they're not caught early.
So if we go on, let's actually talk a little bit more about what autism spectrum looks like, and we can really talk about the first area or in the criteria that is important, which is social communication differences. Now, when we look at this, there are three points here that I want to highlight. So when somebody has these three behaviors that would put them in this category, at least in terms of having these criteria for autism. So social interactions are really important. Children who have autism still interact with other people, for sure, and the degree in which they engage with others differs. So there are some children who don't necessarily try to engage with other people, but there are also those at a different end of the spectrum who do have an interest in engaging. But it's a matter of how they're trying to engage and how appropriate that might look. And along with that, it's about recognizing those social cues that are so important. And I'm going to go into what social cues and recognizing that is after this. But in essence, we have different social norms for every culture and every area in which we live, and it's based on what the adults are doing around us. So by watching and attending to those adults, children just naturally pick up kind of how to behave in different social situations, when to use different voices in different areas, and just what to do in different situations. So the interest may or may not be as strong in some children with autism, but the way in which they're trying to engage with others might look a little bit atypical or different. Secondly, there tends to be a difficulty with expressing oneself non-verbally. So even if they can't communicate with words, these things are also difficult for them, whether it's eye contact, use of gestures and pointing, and their expressions that they have are limited. So, very young children start to have such a variety of different facial expressions beyond just happy, sad, and mad. They can show frustration or disgust or surprise. They have such a complex ability to show their feelings by their face. And then the tone of their voice. They can adjust that and change that based on, what's going on at the time. So, and how they're feeling. So when they're not able to have this sort of consistent eye contact, and when I say consistent, I mean I have seen many children who have eye contact who also have autism. So it's not just having it or not having it. It's a matter of how they use it to gain social interest or engagement with others, and if it's only in one context, like when they want something, or only with one person, like not with a variety of different people in their life. Um, and this last piece is probably the most important, I think, because we want our children to have friendships and be able to share their sorts of um, imagination and their play with other people. At this point, especially in the early intervention population, these children are learning how to do pretend play, and that's how they have these relationships with others. Um, so being able to do that is an important piece of gaining peer relationships. And as I said, just adjusting their behavior based on what's going on around them. So let's look a little bit more deeply at recognizing social cues. Um, so this is also called um, something called pragmatic language. Okay, so social cues are not just, oh gosh, I you have to pay attention to what that other person's face is saying, not just what their verbal message is, but it's also, the ability to use language for different reasons. So not just because they're using words when they see them in their environment and they're labeling those words, um, uh, objects that they see, or not just using language to request something that they really want, but for a variety of different ways. Directing attention, again, the attention piece is really important here. We need children to want to engage with us by paying attention to what we're doing and what's going on around us. Um, and commenting on things that they see. Again, that's showing engagement and socialization with someone else. And then there are social rules of conversations, whether it's taking turns when you talk, not changing the subject continuously to something you want to talk about. And of course, younger children may choose to talk about something they know about, but they can also, as they get older, understand that you kind of keep talking about whatever is the current topic. How close you stand to someone when you talk. Again, these sorts of things may come in naturally as a child gets older, but these things, again, are not typically something that needs to be taught. They're things that the child is watching other parents or other adults in their life, or even older children in their life do. And so they naturally try to imitate them. That's just something that happens without anyone teaching them this. When these things don't happen naturally, um, these are things that we can teach. We can teach children with autism to do a better job at following these social rules as much as possible. And then, as children who live in a bilingual household know very well, um, you have to adjust your language sometimes based on who you're talking to and where you are. Because, children who are bilingual already know who speaks this language and who speaks another one. So they automatically can code switch, so to speak. And this is not something that is specific to those who are bilingual. I think every child who is typically developing does learn how to adjust themselves and their vocabulary based on where they are and who they're with. But these are all things that are more difficult for those who have autism spectrum disorder. The second part of the criteria for autism is restricted and repetitive behaviors. So in this case, only 2 out of these 4 things have to be met. But let me talk about them. Oftentimes, we do see that many children have some aspect of each of them anyway. We often see that children might be repetitive in maybe their movements or language, whether it's some sort of movement of their bodies, like flapping or spinning, even head banging. I've seen, just depending on what they're interested in and what feels good in their body. Or even with objects. They might take something and line it up because that feels just better for them. And then with language, you might see them repeat words out of context. So obviously, when children are learning language, they might repeat after a parent or another person in the room. But if this is a sort of repetitive word that doesn't necessarily make sense based on what the conversation is or what's going on, that's what we call echolalia. And even scripts from like YouTube videos or TV shows or movies, even sometimes songs, if that's being done at a time that, again, doesn't really fit the context of what's going on at the moment. And remember that language is supposed to be a social thing. So when a child is using language in a non-social way, like they're just kind of under their breath saying these words or under their breath singing a song, but not sharing it with another person, that's not really very social. And so that's when we would get concerned a little bit. Next, difficulty with transitions is often a hard thing. And this goes along with the rigidity that some children experience when, a routine happens that's not exactly the same way that they're used to, whether it's being focused on the same foods that they have to eat, even the same brand of food. Sometimes that is often a thing we see, or like the same way, like the same parent has to do certain things with them, and another parent or caregiver can't do that because they're really insistent on things being their way, the way that they're used to. And transitioning from a place of preference to another place can be a consistent challenge sometimes for these children, even when you discuss it ahead of time or give them time to adjust to that. There are often intense interests that we might call perseverative, and so it could be something that's a little bit unusual for a child that age. Maybe it's ceiling fans or light switches, or chords of some type. But the way I look at this is if it interferes with their ability to attend to new things and different toys. Let's say it's a special toy that they just have to have all the time. Yeah, it's okay for them to have a favorite toy, but when it doesn't allow them to try something new or you know, be open to looking at new items or new toys or new activities, that's when it becomes problematic. And we would try to find ways to help that child. And finally, a difference in their sensory system. So whether it's um, a hypersensitivity, so maybe, you know, they can't handle a certain type of texture and they're very hypersensitive to that, or certain smells, or maybe even a hyposensitivity. So, you know, they can hear very, very soft sounds and maybe it's bothersome to them, or um, oftentimes we see children who are hyposensitive to movement. They need that movement that really kind of drives their sensory system and helps them to regulate. But lights and visual things are often things that they gravitate toward. So every child is different, and in terms of this whole sensory piece, it is ever changing, even for one individual child. As much as each child looks different in maybe how sensory input works for them, day to day, that same child can look different, and some things can be affected differently. Um, so it's not a consistent difference that happens from day to day. So now that we've kind of have an understanding of the criteria for what autism is, you know, this is a pretty common question that I get asked about why, what causes autism? And the short answer is we don't know. We don't know everything, but we do know some things that have been in the research as of late. I do want to draw your attention. Each of my slides has references to where I've gotten material from, as well as the videos. But I just want to show that, you know, there are some additional articles and publications that you can reference for further information if you're interested in this. So the one area that we're quite certain does play a role in autism is genetics. There's several theories as to what might happen for children who have autism. It could be that their brain growth is disrupted in such a way that they tend to have a larger head circumference. This is something that we see when we're physically examining a child with autism. And this could be because of cortical surface area growth or excess cerebral spinal fluid, so the fluid inside of their brain. Honestly, it's hard to know for sure if this is why those children have a larger head circumference. That's still, I think, up for debate. And then additionally, how the brain cells communicate with one another might be different or changed. So the white matter, which contains the nerve cells in the brain, might not have the same connectivity as a typical brain, or the channels between them, the ion channels, might be compromised. But already there's at least 100 genes that have been identified as being high risk for autism, but there's an overlap with lots of other types of disorders. So this is an area that is still widely being researched and will continue to, I think, give us more answers as time goes on. We do know that, you know, children who have a twin or a sibling do have a higher chance of autism. And even those who don't have autism may have another neurodevelopmental disorder like ADHD or learning disability or language disorders, things like that. Genetic syndromes can be associated with autism. There are certain ones I've listed here, Fragile X or tuberous sclerosis are just two, but there are many more. And as you can see, there's probably going to be more that we identify. Additionally, children who are born prematurely have been seen to have a higher incidence of autism. The age of parents, whether it's mother or father, can relate to that higher incidence. Um, when we look at environmental causes, there's not as much data to support anything specific, except, we know that, heavy metals like mercury and lead, alcohol, infections that a mother might have during her pregnancy, and then obviously medications that they take that disrupt the pregnancy. These things are not specific to autism, however. I mean, they can cause many different types of developmental issues. So, what is being actively researched right now is an area called epigenetics, which looks at the connection between the child having some genetic uh, issue that's already predisposing them to maybe becoming sensitive to an environmental cause. So there might be more information in this area as time goes on. But I encourage you to read more information about this if that's of interest to you. It's always good to learn more. And this last link is actually just published in 2020, so it's fairly new. So now that we kind of know a little bit more about autism, um, these are some common questions that I often get about language delay and autism. Um, so most of you probably know this already, but when a child is exposed to more than one language, it doesn't mean that they necessarily should have the same amount of language as a monolingual child. Matter of fact, they usually don't. But when you add up the words in one language and the other, they should add up to the same amount. And before we go to that, and I will say, there have been some preliminary studies that show, exposing a child with autism to another language can often help them in some of their social communication deficits, because they're being forced to work through some of these things that bilingual children typically learn early on. So the point is that whether or not your child is bilingual should not impact you to refer your child for some assessments and concerns about not speaking enough words, because if they don't have the same amount of words as a monolingual child, when you add up all the words in all the languages they speak, that is something of concern, and you want to get it checked out. I think this is a common misconception, I think, that many people in the community have, that when someone's diagnosed with autism, that automatically means that they are intellectually disabled or have cognitive disabilities. And in fact, about 60% of those with autism have average or above average intelligence. And as we talked about earlier, there's so many things that when somebody doesn't have those skills yet, it does not mean that they can't learn those skills over time. You might have seen things in the media about concerns for vaccines or a different diet that's recommended, and so I think the biggest thing to say about this is, there's certainly good information and good research to show that vaccines do not cause autism. This is a link to the Centers for Disease Control about vaccine safety that I encourage you to read if you have any concerns about this. But in addition to that, in terms of regression, when we have a child with regression, I think the more important thing to consider that I'm just, I'm constantly learning myself, is whether or not they have any signs of, a seizure disorder or something like that that needs to be investigated for. But a healthy diet that has a variety of fruits and vegetables and protein and dairy is the best thing you can give to a child with autism who may already have a limited diet because of their rigidity. So there's been no evidence that certain diets or gluten-free, casein-free diets necessarily cause or cure autism. Uh, that is to say, I would still take a look and individually at each child and just decide for yourself like what's working for your child and what needs to be tweaked. Um, and finally, this is a common thing I hear, not necessarily now it's because of the pandemic, but parents often worry that maybe if I take them back to where my family is from, where I have a lot of other family members and they can be around other social beings, you know, I can get them back and help them to recover from this. And certainly, I mean, social interaction is absolutely helpful, but I don't think it necessarily is caused by the lack of social interaction. If you understand those two distinctions. So, who diagnoses developmental disorders like autism or language delay? Usually, a developmental pediatrician or a developmental psychologist can help you with identifying this. And often, I encourage, and there are other physicians that I know, certain neurologists or certain you know, geneticists. There's a variety of types of doctors, even pediatricians like myself, who have the training to kind of look at this very in depth and help to identify these issues. I really often encourage diagnostic teams because the extra viewpoint of another therapeutic provider like an occupational therapist whose expertise is movement and sensory systems, or a speech and language pathologist whose expertise is language, can really identify some more critical things that are helpful when formulating a diagnosis and treatment plan. These are some of the different tools and standardized assessments that are sometimes used. Now, I'll say that in the age of the virtual assessments and diagnostic evaluations, things like the ADOS are really not able to be done with fidelity, just because of wearing masks. So people are becoming creative and trying to find better and newer ways to identify children, and still have an accurate way of looking at them. And a good I think diagnostician is someone who can say, you know what, um, I have all the answers that I need from what I can see. And so therefore I feel comfortable giving you this diagnosis. But sometimes you don't. Sometimes that's just not possible with the information that's presented, and it's okay for a diagnostician to say, you know what, we need to come back to this and maybe in person, or let's revisit this in a few months. And I think that is a very reasonable thing to do, especially right now with everything going on. It's always important to check a hearing screen We do that here at Infant and Toddler Connection when anyone has a language delay or we have concerns about their hearing or the parent does. A vision screening is also really important, just because sometimes this can lead to children, you know, using their bodies in different ways, and it's important to make sure that we've identified any problems here. We know that when someone's diagnosed earlier, they can they can have a better prognosis, so their outcomes are better. Um, it's definitely possible to diagnose autism before 2 years. I would say even 18 months is very reasonable. So that's just something that um, as parents, it's important to know and to advocate for if at all possible. And I will say, one, girls do look different than boys. They have um, just a different symptomatology that might fool the unseasoned diagnostician from realizing that their symptoms are related to autism. So it's important to know that that their symptoms can be subtle, excuse me, and then unfortunately, minorities, especially African American communities, are diagnosed later, and it's something that we as a whole community need to pay attention to and listen to parents like you, no matter what background they have, that you are the experts in your child, and you deserve to have a pediatrician or a diagnostician listen to your concerns and take them seriously, because that's the only way we're going to kind of move forward from this and improve these statistics. And the reason that we even try to get these labels in the first place is really just to provide the best sorts of treatment options, so that insurance companies will look at this and say, yes, he does need this sort of treatment and support. And let's look at that next. So one of the most, I think, widely known things that is used for children with autism is applied behavioral analysis. And it's been shown from the National Autism Council that, an intensive course of ABA therapy can truly make amazing gains for that child's development and need for services in the future. When they say at least 20 hours a week, I often talk to parents about, doing what they can do at home. I think if a child is enrolled in a school program, um, oftentimes if they're utilizing some sort of ABA methodology, like verbal behavior, for example, they will be using some of those hours to give that child support. So that is included in those hourly um, week hours per week that is indicated. But honestly, I think if you're giving your child um, attention to what they need and helping them learn something, that is more important than the amount of hours. So when we look at young children and early intervention, we see that these sorts of developmental therapies and applied behavioral analysis combined together provides really the best outcomes for these young children. So it really is a joined effort here. As children get older into school age and beyond, perhaps the ABA research is stronger, but for these young children, parents are really important. And whatever the parent can do to increase that social bond with their child is is going to make a huge difference as they get older. So the sorts of type developmental therapies that are provided here at ITC are absolutely important for children, not just with autism, but with any disorder. Um, I often recommend a genetic consultation just because of what we are, learning in the research about, the genes that are associated with autism, just for understanding and perhaps for later treatment options in the future. Certainly, there's certain children who have difficulty with areas like how much they're eating and if that's enough, if they're getting a good variety of foods, if they're sleeping properly. These things can make a huge difference for each child, and they need to be treated specifically by someone who has expertise here. Um, as children get older, into school age and beyond, certainly medications can help with certain behaviors, specific behaviors. However, it doesn't necessarily mean, that they're going to cure autism in these children, but they can certainly give some benefits to helping a child perhaps attend more during a school classroom session, or be able to control their bodies if they're hyperactive, those sorts of things. Um, before I go on, I will say again, just to clarify, here at ITC, we absolutely believe that we treat all of these wonderful children who come into our lives without any bias for whether or not they have a diagnosis or not. So these things are, recommendations and things that you would want to discuss specifically with your diagnostician or provider that's working with you. But at ITC, we are providing all of these sorts of um, evidence-based developmental therapies based on the child's needs and goals. I think it's really important to note that as we learn more, as more research grows, we're finding that there are children who do grow out of the diagnosis of autism. Um, they might have participated in earlier intervention services, like ITC, like ABA therapy, whatever that might be. Some of these things you can't control what their IQ is at 2 years of age, or we don't know how to make someone decrease their repetitive behaviors. But you, by learning more about this subject, can already try and have your child participate in earlier intervention. And we also know that no matter their IQ or language ability, the quality of life for those with autism as they grow older is really highly um, dependent on family and community supports. So I do want to talk a little bit about what's out there next. Again, this is the article I was mentioning before that might be useful to read if you're interested. So there's a lot of resources available in our community here. First, again, I already said this, but regardless of diagnosis, we treat all children, and the ITC service coordinators and interventionists are here to help um, guide your family and just anyone who has concerns about autism. Um, and we do have a support group available that runs for several months, multiple times a year. It starts. So if that's something you're interested in, I would reach out to your service coordinator for more information about that. Um, there's a lot of assistance from places like the ARC here in Northern Virginia. Um, PTSI is an organization that especially helps with those going into schools and learning about IEPs and different subjects in that area. It's a nonprofit. These are two support groups that are available here in our area, POAC of Northern Virginia and Autism Society of Northern Virginia. and they have a large following of parents like yourselves, and can often provide a lot of support. I highly recommend the website autismspeaks.org. They have wonderful toolkits for multiple concerning behaviors or different activities that you're trying to do, like a haircutting, if that's challenging, or how to learn toileting skills, problems with sleeping, you name it. They've got toolkits for it that are wonderful. So, and they're free. I would encourage anyone to check that out. They also have a first 100 days kit, which offers some guidance for those who have just been diagnosed with autism. This is an organization that really looks in depth at the science behind different treatments. Unfortunately, there are a lot of other types of treatments I didn't talk about today that are not evidence based. So, before jumping in to something like that and spending a lot of money or time, you want to make sure that it's not harmful for your child, and that it actually has some research to support it. So this is a good place to go for that information. Um, Here in Fairfax County, our public schools have a parent resource center that has really wonderful, um, lectures and webinars about autism, about other things, and just a lot of resource material. And then in our general area for recreational purposes, there's the Jewish Social Service Association that has like a lot of mental health support, and the JCC that has great programming, like even summer camps and things that are available. And I'll also mention the Fairfax County Recreation Department that has adapted classes and all sorts of different opportunities for families. If people would enjoy looking at more videos, if that's helpful, or you want to show some videos to other people in the family that aren't able to watch this, these are just a couple other ones that I would recommend. One's from the CDC, and then there's the Autism Navigator. We watched a 2-minute clip today. And then the last is from Kennedy Krieger, which is in Baltimore, Maryland, that has a really nice early signs of autism video. So thank you so much for watching today. And I hope that I've given you some information that's useful for you to take next steps. And feel free to, reach out to us if you have any further questions.